It's a pleasure for me to welcome you all. And today we have with us the beautiful Dr. Aditi Govtrikar, and she has been off on some long holiday come shoot break, and she's just back from her shoot. So let me first ask what her concerns are and what brings her here today.
Thank you, Dr. Taylor, for taking the time out to see me. Basically, my concern is that I have an extremely dry skin. In addition, I'm really sensitive to stress and to sun. So there was a combination of both because there's lack of sleep. We were shooting out in the sun, and plus because early mornings and late nights, so there was a lot of stress. That has taken a toll on my skin. Basically, I also have melasma. I also have freckles. And I have these patches which, they're unsightly. I don't like them and I want to get rid of them. So, which is why I said I'll come to you to ask you, what is it that you recommend for me? And I'm not I don't like too much of invasion, so minimal, yeah.
So basically, see, what happens is our skin has 6 different layers. So whenever we are out in the sun or whenever you are working under bright lights, the top 2 layers or top 3 layers of the skin are maximally exposed to the UVA rays. Now when somebody has the skin type that you have, which is a very fair skin and it's a thinner kind of skin, then you have that much less of melanin in the skin, so you are more prone for getting pigmentary changes. So that can be in the form of developing freckles or uneven skin tone or maybe a patch of melasma. Now our own blood has the potential to completely reverse these changes. Now I'm sure you must have heard of something called as vampire facial, which is all what all Hollywood and Bollywood celebrities they swear by. So I would recommend this vampire facial for you. So because I know
Sounds
you
a
don't.
bit scary though.
It sounds interesting. I mean, it's called as a vampire facial because it's based on our own blood. So our blood has some regenerative cells, and these cells have the potential to act as an anti-aging treatment, and plus they improve the texture of the skin. So in today's treatment, what we'll do is we'll take a sample of your blood that will be processed in a machine which is like a centrifuge, and the stem cell part or regenerative part will get separated as a platelet-rich plasma or PRP. Now I use something called as a Dermapen to inject this plasma back. So it's like an electric device which has a rotating tip, and this tip has like 16 tiny needles. So we first make a small circular motion on your skin to create micro punctures on the skin, and then we inject this PRP or plasma on the skin, and that gets absorbed on your skin. So the total treatment time will be around 40-45 minutes.
Okay, from taking the blood to centrifuging to the entire.
Everything.
And
yeah.
how much will be the downtime? So when I step out from here, how long do I need to stay at home?
Only today. I mean, for few hours, like 6 to 8 hours, we want the plasma to really work on your skin. So you're not supposed to wash your face for 6 to 8 hours. Like it's already evening time today, so you can go home and just let it be today. Next day morning, tomorrow morning, you can wash your face like normal, apply sunscreen, normal care from the next day.
And moisturizer and everything I can
Everything
start
you
applying.
can.
But today nothing. I just
Nothing
keep
today.
whatever you're
Yeah.
applying. And
For a day or so, you may feel a little redness or dryness on the skin the next day, but that's about it. It's not
so the
much
skin
of
will not flake or nothing like that will happen.
It's not like a chemical peel where you have skin peeling off or flakiness of the skin. And the best part is there are no chemicals in it, nothing artificial. So I'm sure she'll be very happy.
I hope so too. So let's
So
go
you
ahead
ready
and
for the treatment today?
yes, fingers crossed. I'm a little nervous, but yeah,
Cool.
I'm submitting my skin to you in your capable hands.
Thank you. So let's move on to her vampire facial treatment, and you can actually see how it is done, and then you can aspire to have skin like Dr. Aditi.
Thank you.
So I'm just going to clean your hair first. Yeah. I'm just seeing where the gaps are, and then we will start the actual process. This is the Dermapen I was talking about. So it does not cause any pain. It's not like an actual injection. There are very tiny needles. Is there any pain?
Oh, I didn't even feel it.
So I'm starting from one corner of the scalp.
Sure.
So the same treatment we'll be doing for the face as well. Let us finish the scalp.
Okay.
Now I am using the Dermapen on your skin to create micro punctures.
Okay.
Are you feeling any pain?
No, no pain at all.
Great. So we will start.
So you use like a drop of plasma and then you...
Yes, and then we create multiple punctures
I see.
and then just massage till the plasma gets absorbed in your skin.
I see. Ideally, what age should one start facials from?
There is no age per se, it depends on the profession also. I mean, if somebody is in a profession where you need to be outdoors, or if there is a lot of skin damage, sun damage, then you can start at an earlier age. But any age after 18 you can.
Can it completely go? Can the brown spots completely go?
It can, but you need to be on a very good sunscreen all the time. Never step out without a sunscreen.
And what about people who have diabetes and all? Can they still do this? Or it's not a problem?
It's not a problem.
Any endocrine, metabolic
No
disorder?
problem, no problem. This will help get rid of the fine lines. And the skin also will get a good texture. Hello everyone, I welcome you all back, and we have Dr. Aditi with us today. So let us see how was her experience 3 weeks now post the vampire facial that we did.
Absolutely. Oh my
Yeah.
God, Dr. Telang, I cannot begin to tell you the compliments that I've been getting.
Oh, that's good.
Because my skin, I think, has transformed completely after the vampire facial, which you had suggested. Of course, I had my doubts because I am a little wary of any intervention where my face is concerned.
Yep.
And given that the field I am in, one is always a little careful. But I think what has improved really in terms of my skin is the texture. It's become a lot more smoother. It's become plumper.
Yeah.
And I just feel younger. I don't know how and
Sure.
why. But yeah, and I've been told that my skin is looking much better.
Yeah.
What I wanted to understand from you is what is the science behind the vampire facial? How does it actually work?
Yeah. So basically our blood has lot of regenerative cells, and what happens is as we age, the number of regenerative cells keeps on decreasing. So we have like 5 liters of blood and the regenerative cells are like few ml. So in a vampire facial, what we do is, if you remember, we first took a sample of your blood and that is then processed in a centrifuge. So when these cells are processed in the centrifuge, the heavier cells, which are the stem cells, they sediment down and the plasma rich component goes to the top. So this platelet rich plasma is what is PRP. So this platelet rich plasma has lot of regenerative cells, lot of stem cells as we call them in the lay language. And when these stem cells are injected in the dermal layer or in the superficial part of the skin, it works on the cell layer of the skin. So if somebody has freckles, that means there are a lot of pigment forming cells, it will help in correcting that. If there are fine lines on the skin, it will help in correcting that. So it works in two ways. One, it will rejuvenate your skin. So the appearance also increases, and in terms of the texture, you feel softness and suppleness. And as an anti-aging treatment also it works. So if somebody is beginning to have fine lines or any wrinkles in the under eye area or the forehead, for example, then it works to sort of reverse the aging clock.
So would you say that one has to wait for the fine lines to appear, or can one do it as a preventive measure? So what I'm asking is, can one start at the age, say 20 or 22, or should one wait for the skin to kind of
it really depends on your skin type. I mean, not everybody is blessed with her kind of skin. So if somebody, for example, is working outdoors a lot and there is lot of sun damage on the skin, or if genetically there is a tendency in the mother or father to have wrinkles early or lines on the face, it makes sense to take care that much earlier. So maybe somebody can start in 25, 30s. And as I said, it's a preventive treatment as well. So if you start it at 25, 30, maybe you can delay the appearance of signs of aging on the face. Yeah.
And do you think one can prevent blackheads and whiteheads with PRP, or is it only fine lines and the pigmentation that it prevents?
See, whiteheads and blackheads basically are overactivity of the oil forming glands in the skin. So that may not change as much. But what I notice in my patients when they come back is that the overall texture of the skin improves a lot. So maybe the blackheads may not be that much visible because the skin overall has a rejuvenated and young
Right.
look.
Right.
Yeah.
And what is the minimum and the maximum dose that you recommend? Dose in the sense that you, for me, Dr. Parag said that you do 1 PRP a month into 3. So
Yeah.
3 months in a row.
Yeah.
And that would take care of my skin for a year almost, right?
Correct.
So is that like a fixed?
No, it will again depend on the type of skin that we are treating, or the same PRP treatment we use for hair rejuvenation as well. So normally we recommend doing it at 3 week or 1 month interval. So for somebody with good skin, maybe 3 sessions are enough, and then you can hold on for a year and then repeat it. For somebody who needs more work on the skin, maybe 6 to 7 sessions at 3 week intervals is what will work well.
Okay, so around 3 to around
6 sessions.
Six to sessions is what is recommended.
Yeah.
Now, the question that many people ask is it going to take care of the deep wrinkles? Does PRP prevent that?
Yeah. So basically, deep wrinkles are caused by loss of volume. So PRP will not technically revert that volume back. But now what we do is we do something called as nano facelift or a liquid facelift. So liquid facelift is we harvest fat from our own body, either from the thigh or the tummy, and this fat is mixed with PRP. So we are combining the benefits of PRP with the volumizing effect of fat.
I see.
So fat will fill, say, the under eye areas or laugh lines or marionette lines, and PRP will work on the skin. So similar to how blood has stem cells, our own fat also has regenerative cells. So combination of fat and PRP, it really works wonders.
Okay, so would you recommend that for me? Because we did pure PRP, so I'm now curious to know when I going to do liquid facial.
Maybe you can hold on for a few years more.
Okay, so that's for the later age group.
Yeah, I mean if there is more hollowing in the under eye area or the temples or the lower part of the face, then you can think of fat for volumizing, because you have a lean face. We don't really want to make somebody look plumper or to look different from what you are. So right now I think PRP or vampire facial is what you need.
Right. So it is okay for anybody to do it. Males, females, it doesn't matter. You don't need to say that, okay, this age group or this gender can go ahead. Anybody can go ahead and do it. And it's obviously a very quick procedure. It doesn't take too long. The downtime is around a day or so. That's it. In my case, I took a little longer because I think of the fairness.
The skin type,
So I had a little more redness, but it did not hurt. I thought that I would have difficulty, but it was completely okay. Now, the next question that comes to my mind is, you did mention that PRP is also used for hair, which I did also in this area. But does it prevent?
Good improvement, by the way.
I think so, yes. Does it improve the skin texture, the skin density? How does it work for hair?
Now for hair, at the root of our hair, there are something called as dermal papilla cells, and those are the cells which have the potential to produce new hair. Now when we start to have thinning, or when we start losing hair, like in 1 square centimeter we normally have 100 to 120 hair. When we start losing hair, we go down to maybe 80 or 70, and that's the time when PRP helps. PRP is not for people who are already completely bald and they don't have any hair follicles left on the scalp. But somebody who's having thinning, early thinning, it works really well. It causes these papillary cells to get reactivated, and then over a period of 3 to 6 months, you will find that the density improves and the scalp coverage is that much better.
So if somebody has a genetic history of baldness and they start this treatment a lot younger, do you think, I mean, have you, in your experience, of course it's a long-term study, have you experienced that they have been able to prevent baldness completely?
Yes, we do it all the time.
Okay.
We do it all the time, and there are many studies on the preventive aspects of PRP for hair rejuvenation. So as you mentioned, if somebody has a genetic tendency, or the father or uncles, they've had early alopecia, then it makes that much more sense to start a treatment early. So the aim would, I would say, would be to postpone the requirement for a hair transplant to as much later as possible.
Absolutely. So
Yeah.
prevention is the best way
For
of
sure.
going
Yes,
forward,
yes,
right? So
yes.
if you guys want good skin, he's himself has, I mean, amazing skin, right? And I'm sure he does PRP himself. Do you do PRP yourself? Because
I'm
that's do you walk the talk is the question, right?
No, but I don't mind getting it done, but I'm still trying to find the time to get it done. But I think I'll do it soon.
Okay, that's great. So prevention, I think, is the way to go forward. If you want plump skin, if you want beautiful skin, soft skin, then PRP, I think, according to me, is the answer. And of course, for thinning hair, to prevent it becoming really thin, that's also a solution for it. So for me, I think every year, 3 times in a year, I'm going to be here for sure, so that my skin remains as it is till as long as it's possible. One more question that comes to my mind is, what about acne? Because people who have acne are really wary of doing anything intrusive to their skin. Though this is not as intrusive, that's another question which I will ask you later. But what about oily skin or acne prone skin?
It does help, because even though somebody has the tendency to break out, that tendency again is the skin type, right? So skin type is something we can't change, but we can really work on improving the texture of the skin, or reducing the oiliness of the skin. So when we talk of treating anybody with active acne, like somebody having lot of boils on the face, then it's better to first take an antibiotic course, let the acne subside, and then plan a session of vampire facial. But if your acne is under control, vampire facial in fact works really well on the marks that the old acne has left on the face.
So it takes care of the scars as well,
Of the
old
scars as well, yes,
So it
does.
lightens
Yeah,
that.
yeah.
Okay, and the intrusion part, what I wanted to ask you is, at times people feel that the plasma is injected, whereas what we did over here was just the small
With the Dermapen.
Yeah, Dermapen.
Yeah.
So what is the difference, and why do you choose to do Dermapen as opposed to the injection?
That's a very good question. So when we started, like 6, 7 years back, PRP was always injected directly into the skin, as you said. But now, since the past 1.5 to 2 years, I have switched on to using what we did, the Dermapen. So with the Dermapen, as you saw in the video, there is a disposable tip, and it comes with a different caliber of needles. So with each point of insertion, you create like 16 punctures on the skin. So the absorption of plasma is that much better, because how many injections can you give? So if you compare giving 16 injections with one spot of dermapening,
I don't think I would have come back.
So Dermapen is much less painful, and you can cover a much better area.
Right.
In
So
terms
do you
of,
see the result being better with
for sure,
Dermapen?
for sure,
Okay,
yes,
all
yes.
right,
And
all
plus the downtime is that much better.
Right.
I mean, the chance of getting a bruise or having a deep pigmentation or anything like that is more, because it's more invasive with a syringe. But with Dermapen, it's that much less invasive, so faster recovery.
Right. When does one wear makeup, or one can start wearing makeup after doing the PRP? Because everybody has a different downtime,
for sure,
right?
yeah,
So generally, what do you recommend?
So normally we recommend that the day that you do the vampire facial, don't do anything, don't apply anything on the skin at least for 6 to 8 hours. So typically I ask my patients to come on a evening to do the vampire facial. So then you can just go home and relax for that evening. Next day morning you are back to your regime. So you can wash your face with a face wash, you can apply sunscreen, wear a light makeup from the next day itself, not a problem.
All right. And given the fear now of COVID, what are the measures that you're taking? Because when I asked you, you did explain the whole procedure, but I also want our viewers to know what is the care that you're taking, because obviously when you're doing PRP, you cannot wear a mask. So you want to explain it to all our friends
absolutely.
over here?
It's a very valid concern that Dr. Aditi has raised, and I'm sure in today's COVID times, everybody is that much more worried about doing a procedure where you will be without a mask. So how do we take care is basically the room is sanitized between each treatment. So once a patient leaves the room is sanitized, all the sheetings are changed, and we basically use only disposable stuff. So everything that gets used in the previous treatment is all gone, and you then enter a sanitized room. My assistants that you saw, they will all be using hand gloves and masks all the time. I myself will be using a mask all the time. So we ensure that we maintain adequate distance from the patient, and in terms of wearing masks and hand sanitization, all the established norms are followed. So it's not much to worry about.
Right. So thank you, Dr. Telang, for
Pleasure.
introducing me to this treatment and making my skin look so good.
No, it's been a pleasure to have you at our clinic, and very kind of you to accept to give your feedback on this vampire facial treatment, because you are somebody who's into very natural way of
Yes.
doing stuff, and that's why I recommended a vampire facial to you, so that it's your own blood, there are no artificial things, no chemicals in it, and the results you can see for yourself.
Yes.